Well, hello, my name is Dr. Nicholas Orm. I'm a cardiology fellow at Mayo Clinic, and I'm the lead author on a paper that's been accepted for publication at Mayo Clinic Proceedings entitled Imaging Pandora's Box, Incidental Findings in Elderly Patients Evaluated for Transcatheter Aortic Valve Replacement. We had noticed in our clinical practice that incidental findings are common in elderly patients, and this often is a very difficult clinical situation to be in, to know when to work up these findings and when to pursue them with additional diagnostic evaluations. As our elderly patients with aortic stenosis have been evaluated for the new procedure TAVR, or transcatheter aortic valve replacement, they undergo a CT scan from the chest all the way down to the pelvis, looking for suitability for the percutaneous valve replacement. And as a result, we get nice high-quality diagnostic images with contrast of all of the structures outside of the aortoiliac femoral vasculature, which are incidental to the purpose of the study. So we were interested to know how often these incidental findings occurred and what their clinical impact was and/or relationship with overall survival. So we looked at 424 patients that had severe aortic stenosis and were being evaluated for TAVR and received this CT scan. We call it a TAVR CTA scan. And of these 424 patients, what we found is about 2/3 had at least one potentially pathologic incidental finding. And we define that as basically any finding that was serious enough that it might result in a diagnosis of a malignancy or new or worsening medical condition. And then we searched and saw how often these patients had a clinical workup by the physicians that were caring for them. And what we found is that of those, 2/3 that had at least one finding, we found a total of about 9% of the 424 who went on to have additional evaluation for these incidental findings, which were found kind of by accident. And we found that the TAVR procedures or aortic valve replacements were canceled in over 1% of the case, and we calculated a number needed to image to diagnose a new cancer or a new major medical condition, and that number needed to image was about 19, which is pretty high. So when you look at the different imaging modalities that have had work and research done looking at incidental findings, the TAVR CTA scan has the highest percentage of patients who have potentially pathologic incidental findings. And has a very high amount of patients that get referred for additional workup, nearly 10%, like we said, which is higher than any other imaging modality that has been described in the literature. And one unique thing in our paper that we found is, as we looked at the number of potentially pathologic incidental findings, and we looked to see if there was a correlation with overall survival, we found that the more numbers of those findings that you had, the worse your prognosis seemed to be, even when we adjusted for comorbidity. And this is a unique finding. Hasn't been described to our knowledge in the literature elsewhere, that the number of incidental findings can correlate with overall poor survival. So the question is, what do we do with these results and what does it mean for patients? Well, I think that centers that do TAVR need to know that these CTA scans are highly likely to generate incidental findings, and there needs to be a mechanism not only for detection but for communication, because these patients are going to come to specialized centers and then they're going to go home to their primary care doctors, and we don't want to miss new diagnoses of cancer, even though they're an elderly population. And then just in general, there needs to be more research to know what to do with these findings. In an 85-year-old person with severe aortic stenosis, should every indeterminate liver mass be worked up? And is that cost effective? And is that in the best interests of the patient? So that was our study. We're really excited to present it and share with the scientific community. Thank you very much.
We hope you found this presentation from the content of Mayo Clinic Proceedings valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you will find access information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.com. This video content is copyrighted by Mayo Foundation for Medical Education and Research.